Joining us now to talk about it is Hawaii Governor Josh Green, who is also a physician. Governor, thanks for being with us tonight. I'm so glad to have you on tonight because you have a firsthand understanding of what kind of health Secretary Robert F. Kennedy Jr. would be. I want to set the story up for our audience. Kennedy visited the island of Samoa in 2019 and met with anti-vaccine activists as the country's measles vaccination rate was plummeting after a scandal over improperly mixed vaccines. 4 months after the visit, there was a measles outbreak that infected 5,700 people and 83 people died, including many young children. Kennedy has denied he played any role in this, but as Lieutenant Governor, you led a medical mission to Samoa and vaccinated tens of thousands of people. What is your take on what happened?
Well, thank you, Reverend. Yes, I was there in person. Let me just be very clear. RFK Jr. is the worst possible nominee for HHS Secretary. In 2019, like you said, I was Lieutenant Governor. The outbreak was upon Samoa, and he went and torpedoed confidence in the vaccination of that country. So thousands and thousands of cases were spreading. I was contacted by the Prime Minister of Samoa to come in with a medical mission team, which we did. We came in with over 70 healthcare providers, myself included, and we did 36,997 vaccinations over 2 days, and measles stopped. But what he did by destroying the confidence in that nation's healthcare system directly resulted in the deaths of up to 83 people. And like you said, almost all were children under the age of 5, because when you scare people away from getting vaccinated or from other public health initiatives, they run for cover and they expect to get good advice. They rely on good advice. But this person torpedoed and destroyed their confidence, and those individuals died. And we had to come in and save the situation. This is exactly what will happen if he's confirmed as HHS Secretary. We already have some challenges in our nation to get vaccinations to communities, especially rural communities, underserved communities. And when he throws this program under the bus or doesn't show commitment to it or spreads false information and false claims about vaccinations and their safety, millions of people will stop getting vaccinated. And then you'll get surges in measles, you'll get surges in polio, you'll get surges in meningitis. And it will either kill young individuals and our children, or will leave them with neurologic damage. I'm a physician. I came to Hawaii with the National Health Service Corps. I practiced full time all the way until I became governor. And I will tell you this is a cruel joke that President Trump is playing on the American people. The Republican senators have to reject this nomination. It would be okay, I suppose, for RFK Jr. to go work in the environmental sector in the Trump administration. But that's the important thing.
Yeah.
President Trump has an obligation to appoint people that have experience. And RFK Jr. has no experience as a nurse, as a doctor, as a social worker. He's never had a degree in public health. He's simply a bombastic personality. And this time people are going to die if he's confirmed.
Now, RFK Jr. hasn't just been talking about vaccines. He wants to end fluoridation of water, which experts say prevents tooth decay, and broaden access to raw, unpasteurized milk. He wants to turning back the clock on food safety by a century. As a doctor, what's wrong with Kennedy's approach to health?
Well, everything is, but let's talk about fluoridation. When children don't get any fluoride in their water, they end up with terrible, terrible oral health, which leads to delayed development. They can't eat properly. There are all sorts of infections that occur. So he's an anti-establishment type. Ironically, and Donald Trump doesn't know this, he's a radical on the left side of some of these issues too, which is very strange because since they don't vet anybody, a lot of these kind of disconcerting nominations occur. On the milk question, for example, right now, there's H1N1. This is a virus out there, the bird flu, and those viral particles can get into milk when they go through cows. That's one of many reasons that that's a dangerous proposal. RFK Jr. is probably trying to live up to some of the demons that have plagued the dear Kennedy family's lives, and we are so fond of them in general. But there's something wrong with this gentleman, and all of his opinions are disruptive, which is why Donald Trump loves him. He simply traded his endorsement, of course, for this HHS nomination. But at the end of the day, it's going to cause great harm to all of our healthcare system, but particularly to children.
Now, many of Kennedy's ideas are extremely popular online. In the African-American community, there's an understandable wariness of the public health system because of our history, such as the Tuskegee experiments and other incidents. What's your message to people who are open to these kinds of things that RFK Jr. is talking about, and maybe even excited about him? What is your message to these people?
My message is speak to your pediatrician or your family doctor, your internist who you trust. Do not talk to some quack who doesn't know anything about medicine, who has no training, that's doing it for popularity and clicks on the internet. I mean, it is an obvious absurdity that he would become the HHS secretary, and everyone knows it. I mean, everybody that is anywhere near the field knows that, Republicans or Democrats. It's totally okay, of course, for President Trump to put people of a similar ideology to him. This guy doesn't even have a similar ideology. He is a farce of a healthcare nominee, complete farce. But what I would say to people is trust your doctor. Trust your nurse practitioner, trust your social worker. Don't trust this guy. And I really do want to reiterate, when I ended up in Samoa as a lieutenant governor and physician, we literally saw children dying right before our very eyes.
Wow.
And then we would go on and have to vaccinate their loving siblings. And there's a real track record there. I'd be more than honored to come and testify in front of the Senate if they wanted me to about this nomination, even though I'm a sitting governor. And again, it's not personal. He could serve in some other capacity, but we can't allow him to hurt our children. And beyond that, it is a $2 to $3 trillion budget that the HHS secretary is responsible for. He could immediately cut resources to women's reproductive health, community health centers, the National Health Service Corps, the CDC, and that's what a gentleman like this would do. So let's calm down, everybody, and pull this nomination and maybe a couple others back, and put people in there who are qualified, even if we think that they don't agree with the right ideology. That's what elections are about. We will endure that, but don't put people who will do harm.
It's about life and death. Governor Josh Green, governor of Hawaii, thank you for being with us.